Dale Payne, then Joshua Brandt, and Barbara Skoke. All official meetings of the board shall be open to the press and the public. However, the board may meet in executive session. Citizens are encouraged to address items on the board agenda or to initiate presentations of issues appropriate for school board consideration. The board meeting is not the appropriate place to review individual employee performance or individual parent complaints that have not been addressed by the principal or superintendent. Citizens are encouraged to follow the normal channel to address such problems, and each speaker will have 5 minutes. Ms. Payne?
Good afternoon, or I should say good evening. I want to thank you for this opportunity first to be able to speak about a certain situation that a lot of my friends who have grandchildren are concerned about. And after seeing all these wonderful teachers, I don't think that we need to be as frightened about the subject as we are now. And I'm just going to read, because if I don't, I'll mess up and I'll miss my opportunity to say what I need to say. Let's see. I was going to tell you that I am a mother, I'm a grandmother, and I'm a great grandmother. And I've worked with children all of my life, all of my adult life. I'm a Sunday school teacher. Children are precious to me. All children are precious to me. All races are precious to me. This concern will affect innocent, this what I'm going to talk about will affect innocent lives of all races. I have no children that attend Muskogee public schools. I do have friends and grandparents that are concerned about their grandchildren. It seems to me our country is in a grave danger of becoming a communist country. Our forefathers fought for America that made America a place where we could have liberty and free speech, freedom of religion, freedom of assembly. We have fought 2 major wars to keep our lands free. Since January, lives have been turned upside down, and our government has made havoc of so many lives. Let's see here, I've lost my place. And I'm afraid it's our children who have suffered the most.
Whose government has done this?
Our government, ma'am, our government has. We have a crucial race therapy that has popped up, and we're concerned about it being taught in our schools. The name of it is the critical race theory. And we would like to know if this is going to be a curriculum in the future of our schools.
Go ahead, ma'am, and continue.
No, I'm asking a question. What will be the curriculum in our schools coming up in the future?
And Dr. Lewis, you may be able to get someone to.
Sure, we'll follow up with her. That's no problem. If I can get her. Miss Jones, do you have her contact information?
I do. I have her contact information.
I'll be happy to follow up with you, ma'am.
Thank you so much.
Okay, your remaining 2 minutes now.
Okay. We pray that the racial race theory will never be a subject that you would even contemplate. President Trump issued an executive order banning critical race theory based on training programs in the federal government. The day President Biden took office, he canceled President Trump's order. Our neighbor in our community has a sticker on her car. It says, "I am just a normal mom just trying to raise my kids not to be communist." And I hate to bring this subject up because it's been such a pleasant evening, and I do apologize for that. But this is concerns of a lot of our Americans, not just Columbus, Georgia, but a lot of our Americans. And I thank you so much for your time.
Thank you. We have your number and I will follow up with you, ma'am.
Yes, ma'am. It's 706-897.
We have it, Ms. Payne. We
You've
have
got
it.
it? Okay,
Yes.
I apologize.
ma'am.
Was that not what he was
Well,
asking?
I said I have the number and I will follow up
Oh.
with you. I didn't want you to put your phone number out there
It's
for everybody in the world to
Oh,
hear.
well, everybody wants to call me. Please do. I would love to talk to you.
Not
Thank you
everybody's,
so-
not,
Thank you so much, and God bless you all for being
Yes,
the
ma'am.
teachers and the people that we need you to be.
thank you.
All right, next we have Mr. Joshua Brandt.
Hello, my name is Joshua Brandt. I'm the parent of a kindergartner at Clubview Elementary. Good afternoon, ladies and gentlemen, members of Muscogee County, Muscogee School District, faculty, and parents. Since the start of COVID, there has been fierce debate as to how best control the spread of the disease. Initial reaction by MCSD was no in-person classes, followed by the choice model that mandated all in-person students and teachers be masked. Jumping ahead to today, it is my and many other parents' conclusion that the requirement to mask our children should be left to the parents. COVID mitigation measures at MCSD included enhanced sanitary procedures, increased hand washing, social distancing, masking, and requiring students who were sick or running a fever to stay home. To assume that any single measure employed was the most effective is illogical at best. If we reference current events, we see that states with the most relaxed guidelines on masking and social gathering are seeing record low numbers, while states that have been most restrictive have dealt with more prolonged recoveries. Speaking specifically, Texas, one of the most open states throughout all of the COVID pandemic, has had 0 deaths as of today. Excuse me, today was 0 deaths. Some have raised the concern for safety of the teachers and other students if we go to a mask choice model. Some have even gone as far as saying teachers will be risking their lives. I find comments like these to be emotional and not based in logic. Currently, the COVID vaccine is available to all adults and children over 12. The CDC has stated that if you are vaccinated, you do not need to wear a mask. If teachers are concerned, they have all tools at their disposal to be vaccinated and be safe. Children experience a lower rate of infection and hospitalization from COVID, so parents with concerns about infections are free to keep their children masked. On the point of mask wearing, the CDC recommends a child's ability to wear a mask needs to be assessed. Can they wear it correctly, to include washing hands prior to donning the mask? And are they ensuring proper fit? Can they avoid frequent touching of the mask in the face? Can they limit excessive saliva on the mask? Can they remove it without assistance? As a parent, I can assure you that not all of these standards for proper wear can be guaranteed on any given day. Excuse me. Which makes me question, if they can't be worn properly, why are they being forced to wear them at all? The CDC has stated that it's permissible to not wear a mask outside when social distancing can be maintained. Yet Dr. Lewis has said due to that not being achievable for elementary, our children must remain masked while outdoors. Why are we cherry picking which guidelines we must follow from the CDC? Lastly, based on the absence of a child psychologist on the MCSD medical board, I am of the opinion we are ignoring a huge facet of the emotional toll on our kids for a virus with a 99.5% survival rate. In conclusion, going forward to the next school year, give the right to choose back to parents. Allow us to choose what's best for our kids and our families. We are all expected to assess our risks and step into the world each day. Denying parents the right to do what's best for their families devalues our roles and responsibilities as parents and as role models. It is for this and all the previous reasons and references provided that I say give parents the choice to do what is best. Thank you for your time and attention.
Thank you, Mr. Brandt. Is Mrs. Scott there? Barbara Scott? All right, then looks like that concludes. Are you,
No, I'm here. It's just us here though, so you got to give us a little bit.
go ahead.
Oh, my 5 minutes starts. Okay, hi y'all. God bless Josh, because I don't have to say any of that, and he's absolutely right. Everything he said, backtrack true. God bless Gail. Oh my God, bless her heart. That's our next battle, so don't worry. I spoke last week, but again, I'm Barbie. I'm Muskogee County's reps for Moms Against the Mandatory Masking of Our Children. I'm going to read also this time because I screwed up our website last time. It's www.momsagainstmandatorymasking.com. We're not against optional masking. That's actually what we're fighting for. So if people want to wear masks, they can, and we think they should. However, with vaccines being so great and abundant and readily available, I hope those who want to and need to get a vaccine, and we can all be maskless, most specifically our children though. So for those that would like to link up with us, this year, this was all pushed on us and there was nothing we could do about it because it was so unknown. Next year, if Mr. Lewis chooses to make the same decisions and keep masks mandatory, then we need to be ready to push back on that. We weren't allowed to push back. I pushed back a lot this year and I thought I was all by myself. Come to find out, after last week, there were tons of people just asking very common sense questions and getting non-responses just like me. We just asked, what are the goalposts? What are the numbers? Like, we get it that it's unknown, but what markers do we have to get to go back to school? What do we have to do for you not to tell us a week before school is about to start that school is not going to start for another 2 weeks? We need to just be able to be more involved in the decision-making process in Muskogee County. Like, it's either our school district or it's not. And so we need to have a say, even though we're not just going to sit here and parrot everything everyone wants us to say. And so, yeah, we're the odd men out here. We get it. We know, like, that's just how that goes. But if we're going to be an educational and academic institution that just says, do as we say, rather than ask questions, and this is why we're doing it, and this is who's involved, then that's not very educational or academic. I would go off like that. This is sad, what I'm about to say, but we are where we are. The thing that makes science science is that it welcomes an opposing view. It allows for scrutiny of data. It allows for assumptions to be questioned. It allows for you to disprove what has been proven already. That's what science is. And so when you have the issue of COVID, and you have people being attacked or silenced because they're not repeating like parrots what other people are saying, now you know it's not about science. Now you know it's become something else, and that makes me question it even more. And so here we are. And so since our questions are never answered with anything other than, I share that desire and I defer to my medical panel, I emailed everyone on the medical panel. I got one response out of 19 people. Okay, well, Dr. Lewis said he's not an MD, so he defers to the medical panel. He just gave us the names a week ago of who was on the medical panel that he deferred to at the beginning of the year and all year long. We finally got the names 11 days before the end of school, so thank you. At least we have them for next year. However, when I got the one email back, they responded for 4 doctors. I simply got an outdated CDC PDF. They said, we defer to the CDC. And I said, great. So now that the CDC has changed their guidance, will you? No response. So that's all I get from the medical panel, but I didn't elect the medical panel, and the medical panel is obviously not mine and doesn't work for me. So I'm not really sure why we need a medical panel if they're just going to defer to the CDC. But are we going to follow CDC guidance, or are we just going to do whatever Dr. Lewis says, or are we going to do what the medical panel says? Or are you going to let us in on this conversation next year? Because that's really all we want. We just want optional masking, and I don't really see how you can mandate it, but I do want to make sure we're organized next year in case you do, or in case you do it again for a next one, or even for the next battle. So anybody that just wants to be a part of speaking back with Muskogee County School District, we're here. We can see why nobody comes and nobody's involved. Nobody shows up. The school board's not even here. Nobody's here. I'm assuming the superintendent's here, maybe up in his office. So you're in the building, maybe?
I am not.
Well-
No, so everybody's in their comfy home, but we're here waiting all this time to speak. I mean, poor Gail is like, I just want to talk about something that's going to affect us in the future. And
Stop.
she's talked back to like,
Stop.
she's not making any sense. So, okay, yes, I'm done. www.momsagainstmandatorymasking.com. Thank you. Sorry, Miss Green.
Thank you. Have a good evening. All right, board members, we are moving on to our action agenda.
Ms. Green,
Yes, ma'am.
I was just wondering, in light of all the comments, I think Dr. Lewis, you're going to continue to meet with that panel and bring back recommendations for us to vote on regarding the latest available information that you have. Is that how we're doing that?
Or if not for us to vote on, as the educational leader, he will give guidance.
I'll make, yes. I'm
That's
making that
correct. I'm
decision.
sorry. You're going to make that decision.
Right.
Because I was wondering as the speakers were speaking, just as those are parents who want optional masking, there are parents who want mandatory masking. And so I know that there's a lot of considerations that we have. I also noticed that there was a comment that it should be a parent's choice whether kids wear masks, but there are also other health conditions that I'm wondering if these parents think that maybe it's a parent's choice to send their children to school with fevers, because when kids come to school with fevers, they can that affects other children at the school, and that impacts the health of the other children at the school. So I'm just wondering how we were going to do all of this. And I know you're going to be listening to all of the health panel, all those people that are on the panel. They may not be doctors, but they're on the panel, and bring us the best decision based on the information available.
Ms. Buck, I've been very consistent since we implemented the medical panel last spring. I'm very pleased with where we've responded as a district. And I appreciate very much the time given to our panel by the experts who are epidemiologists, pediatricians. They represent the CDC, the Department of Public Health. I'm very comfortable with who we are utilizing and the expertise they bring to the table. I will continue to listen to them as we make our decisions, and we have already made some adaptations. One of the incorrect statements this evening was the fact that we don't that we require masks outdoors. We have modified that in line with the CDC. We are not requiring masks outdoors. We will require masks for the remainder of this school year, and we'll make other future decisions, again, based on the guidance we receive from the professionals and the experts.
Thank you. And also, is there a way so that one of the parents say that they don't know who's on the panel? Is there any way we can?
It's on the website.
Thank you. Put it on the website. Okay, so we
It's
want
already
to
there.
we want to make sure that everybody has access. Okay.
Yes, ma'am. And we
Thank
do
you.
welcome people's thoughts and opinions, but again, we have to make decisions for 31,000 students, 5,000 employees, and all indirectly for all those that impact throughout our community. So it's not an easy decision ever to make it, and I fully realize people are passionate about their particular side, but we're going to defer to the experts in the field.
Dr. Lewis, just a general question. How have we communicated to the parents in preparation for next year? Have we
have not made that decision yet.
Person or choice or?
We have said for the last 2 months that we are going to be going back in person.
Right.
And that we'll be using a very restricted virtual option for those medically fragile children or those who are medically fragile in their homes. They'll be able to apply for that restricted virtual environment based on their doctor's notification and documentation, on balance with how the students have performed academically if they've been virtual to this point. So we'll be moving forward with that. We're finalizing that as well, and we'll have that information out for all of our parents consider. But by and large, we are expecting everybody to be back in person to start the fall at this point for the based on what we know at this time.
Okay, sounds great.
Yes, my pleasure. Thank you.
Thank you.
And also, just as a reminder, I think that the superintendent the faculty and staff, the entire administration, all of our dedicated and committed employees who are inside of the school buildings did an excellent job. Missed something that we had no idea. None of us knew then, and guess what? We still don't know. And I think that everybody did a good job. And the best thing that we could have done was provided an opportunity for parents to have a choice.
Absolutely.
And we're able to